Welcome to the second episode of Gut Health Insights. In this second episode, I'll be talking to you about irritable bowel syndrome, the way I talk to my patients, provide information to understand the underlying pathophysiology, and also derive the current best treatment options. Irritable bowel syndrome, or IBS, is a disorder of brain-gut interactions. It is common. It affects about 15% of the population. The symptoms are chronically recurring abdominal pain and altered bowel habits. And the symptoms are stress sensitive with common comorbidities such as other pain disorders or anxiety and depression. There have been many concepts in the past about IBS and treatment targets. To summarize, the most common one that have been pursued and proposed, that the main factors that drive IBS symptoms are psychological factors such as anxiety, stress, and trauma, and that the symptoms come primarily from so-called motility disturbances of the gut, in forms of spasms or transit alterations, how fast and how slow the contents of the gut move through, disturbance of secretions of fluid and mucus. SIBO has become a popular explanation, small intestinal bacterial overgrowth, and food intolerances. The treatment approaches from these concepts have been traditionally reassurance by the physician, psychotherapy only in most severe cases, and also medications that decrease anxiety. In terms of the motility aspect, the gut aspect, common remedies include antispasmodics, medications that reduce the contractility of the gut, prokinetics, medications that speed up the transit through the gut, medications that inhibit secretions such as Imodium, so-called antidiarrheals, antibiotics, and dietary changes. And the recommendations in terms of diet have varied tremendously over time. So when I was in my training, a fiber-rich diet was recommended based on guidelines. Today, almost the opposite is being recommended, to take out many of the fiber-containing food items in the so-called low FODMAP diet. Our research group at UCLA over the years, I would say over the last 20 years, has really pursued a very different approach, and it's gone from studies of epidemiology and psychology to brain science to explain this syndrome. And I'll walk you through what sounds initially very complicated, but something that most patients understand intuitively when a physician takes the time, when I take the time to explain it to them. The concept of the brain-gut microbiome system, or the brain-gut axis, is illustrated here. We have a complex system in the brain with circuits and networks that generate an outflow from the brain to the body, to the gut, can modulate gut function. We have, at the gut level, a very complex system, what's also been referred to as the Gut Connectom, composed of many different cell types, immune cells, so-called epithelial cells lining the gut wall, nerve cells, endocrine cells, and they interact with these trillions of microbes. There's also a communication between the gut, between the output of this connectome back to the brain, and that, as we have shown in many studies, plays an alteration in that feedback system, plays a big role in the IBS symptoms. So this is illustrated graphically here. We believe on extensive research, but also on the interactions with patients. Many patients know that intuitively themselves, that they have an increased perception of stressful life events. So the same kind of life event or signal from the body that many people will not pay much attention to. Patients with IBS have an increased perception of that stimulus, this perturbation, as stressful, and therefore trigger a response of the brain, the stress response, in form of the autonomic nervous system. So this is the sympathetic nervous system and the one branch of the vagus nerve. It then sends a signal back from the brain when this happens back to the gut and alters the interactions of virtually all the cells that are in the gut. So if this is something acute and transient and mild, it has may not have a big effect or may not have an effect at all. If it's severe, if it's prolonged, or if it's chronic, then this system that translates what goes on in the brain to the gut has a major influence, both changing the composition, but also changing the function. Now, once this system in the gut changes, it will generate several things. One is this visceral hypersensitivity. So the brain-gut system will become now more sensitive, not just in terms of stress responsiveness, but also to a lot of peripheral events, such as distension of the gut after food intake, contractions, normal contractions of the gut, many aspects of food, and also medications. So many patients report different types of food sensitivities, and also typically report that they are more sensitive to the side effects of medications. So these three factors, the increased stress perception, the subsequent increased stress responsiveness in terms of the autonomic nervous system, and the increased sensitivity to events that go on in the gut are sort of the quintessential elements to understand IBS. So let's go a little bit deeper into the brain. So don't even try to understand this complex diagram that shows all the different networks and nuclei and regions in the brain that are important. We, over the years, have, through the use of brain imaging, been able to dissect this system into individual networks. And let me start out with, or let me highlight the ones that we think are most important to explain IBS symptoms. So there's something called the Salience Network. This network in the brain, doesn't matter now the details of the regions, but this network assesses the salience of any internal or external stimuli. It doesn't only respond to the actual stimuli, but also to the expectation of such stimuli. So if somebody is concerned about that something that's going to happen in the next hour or over dinner may cause symptoms, that is calculated by the Salience system and then further processed down the, all the way back to the gut. The system also plays a role in the prediction of outcomes. So it will predict if something is harmful to the patient or it's benign. If the prediction is harmful or threatening, that this is going to cause pain, or this is going to cause bloating or discomfort, then there's an engagement of another network, the attentional network or central executive network. So once this system kicks in, the attention will be now focused on this particular symptom or this particular event, and it will amplify it over other stimuli. So, this could be on the sensation of bloating, distension, gas, pain. And we know from many studies outside of IBS that any of these sensations require a focused attention to actually become a symptom. Distraction will make often the symptoms disappear. Another network that will be engaged in response to the Salience Network assessment is the emotional arousal network. This generates emotional arousal at the brain level. And then once that happens, it engages the fourth network, the central autonomic network. This is a system that generates the outflow of brain activity in form of sympathetic nervous system activity or vagal or parasympathetic nervous system activity that goes back to the gut and that alters the gut function. For example, it modulates motility, the way the gut contracts. Secretion can modulate permeability or leakiness, can modulate immune function. And it, as I'll show you, it can also modulate the composition and function of the microbiota. So where it starts is really the way this Salience system is biased or set up to make either a warning signal to the rest of the brain or a system of safety and non-responsiveness. These systems in the brain obviously develop over time. We know from many studies, from epidemiological studies, that many patients with IBS can trace back the earliest symptoms to their childhood. Often the parents can comment on that if the patient doesn't remember. This doesn't have to be necessarily in forms of IBS symptoms as first symptoms, but it can be symptoms of anxiety or other discomfort. So how does that develop? So obviously our genes play the primary role in terms of determining how these brain systems that or networks I just explained to you develop. And there's multiple perinatal factors such as early adverse life events. And there's many studies that have shown that such events, anything from divorce of the parents, to disagreement between the parents, to physical abuse, sexual abuse, all have an influence, and they can through mechanisms modify the expression of information from the genes, so-called epigenetic modulation. There's also good evidence to believe that some substances are produced by the gut microbes in the developing gut, also have the ability to modulate both gene expression, but also the development of some of these networks. So with the child growing up, we have now an adult brain that has fully developed brain networks, the ones I showed you previously, including the stress responsiveness and the Salience Network. And now in adult life, patients or individuals are exposed to what's called allostatic load or chronic severe stress, to unhealthy dietary influences, to infections. So many things can alter the adult brain, but it's always based on what has been programmed early on. So then ultimately what results are brain networks that are the hallmark of a patient's brain, how she or he will respond in the future, not just to gut signals, but also in the evaluation of potentially threatening events in the environment, creating anxiety and emotional arousal. So in a simple way, this is how a brain-gut disorder develops from early on in infancy to the adult. Now let's take a look at the gut. The gut, I mentioned it earlier, is a very complex system being composed of immune cells. 70% of the immune cells of the body are localized there. So-called epithelial cells, these are the cells that make up the lining of the gut. These cells are tightly coupled through gap junctions, so nothing can go through in the normal gut. There's also these hormone-producing cells, serotonin-producing cells, so the interaction of all these cell types to produce a joint function is called the Gut Connectom. And about 10 years ago, 10, 15 years ago, we realized that this is not enough. The gut part of this connectome, it also interacts closely with the microbes that are in close proximity of with this epithelial layer. And in my previous episode, I explained to you how changes in this interaction can influence the output of the gut connectome. So let's see what happens with so stress and emotional modulation of the gut microbiome. So we know that stress and emotions, negative emotions, can change the transit of the gut, normally to speed up the transit, increase secretions, decrease mucus secretion, change blood flow, and through these changes, alter bowel habits and cause abdominal pain. The hallmark of symptoms of, or like one of the hallmark symptoms of IBS. And we understand the mechanisms of this interaction pretty well. So these changes in transit, secretion, and blood flow change basically the environment or the habitat in which the microbes live in, and have been shown to change the composition, the relative abundances, and the function of many microbes. But in addition to that indirect modulation through these gut functions, there's also direct modulation of certain gut microbes through the release of stress mediators, such as norepinephrine, into the gut lumen, which interacts with receptors on these microbes, changes their behavior, makes them more virulent, and alters their interactions then with the gut subsequently. So we know pretty well how psychosocial stress and emotions can generate this top-down mechanism that not only can change gut functions and can produce symptoms, but also can change the gut microbial function with all the downstream effects of that. So if you put all this together, so a putative temporal sequence of altered brain-gut microbiome interactions in IBS. As I mentioned in a previous slide, genetic and epigenetic factors early in life make up the programming of the brain in the first 1,000 days of life, which then will be maintained more or less in a general way throughout life. If in a brain that's predisposed through these early life events, if this individual encounters chronic stress, so early adverse life events or trauma, this brain will show an increased responsiveness to the stimuli, which will then alter the gut microbiome, the gut functions, as I mentioned, and the microbiota directly. This will change the output, the molecules and the chemicals and the mediators that the gut microbiota produce, but also changes interactions of microbiota with the gut, with our gut. And that influences, for example, gut immune functions. All these changes then can either directly or indirectly feed back to the brain and further modulate these networks. So we have a circular process, and that is one of the main reasons why it's something that is a simple reductionistic approach of treatment is unlikely to work for such a complex interactions of multiple factors. So just to summarize this here, stress-induced alterations of the gut connectome, changing microbial composition, increase gut permeability, make it more leaky, and immune activation, and then the feedback of these molecules generated in the gut, which can be microbial, neuroactive metabolites like tryptophan metabolites, or immune mediators that alter the brain. So what patients may ask, why is this important? Why do I have to know this? Well, it's quite important because in order to understand how therapies work on this system, I think it's important to be aware of the complexity and the main players that are involved. So we come back to the same schematic of the four networks in the brain. There are more networks, but the four that are most relevant for this IBS story: the Salience Network, Central Executive or Attention Network, Emotional Arousal Network, and Central Autonomic Network. And now we see in these boxes the therapies that are targeted at these abnormalities. So cognitive behavioral therapy in its different forms has been shown to be one of the most effective therapies in IBS, but also in many other disorders such as anxiety, depression, um, even disorders like um, early Alzheimer's disease and many more that involve a dysfunction of the brain. So cognitive behavioral therapy is available both in terms of the traditional way of multiple sessions, face-to-face interaction with a therapist. Expensive, time-consuming therapists are not always available. And the most exciting things in this field is that there's now new approaches, new possibilities of use internet-assisted or web-based cognitive behavioral therapy approaches, which can be done from your home. So one of the goals of CBT is to change the bias that the Salience Network have to assess the stress responsiveness, the negative variance of a stimulus, and then indirectly, obviously, the central autonomic output. The central executive or attentional network also amenable to CBS strategies, but there's also hypnosis and mindfulness-based stress reduction approaches, which have become very popular and are now available in many places outside academic centers. In terms of the emotional arousal network, relaxation techniques, abdominal breathing, for example, deep diaphragmatic breathing, simple, very successful. In general, approaches of stress reduction that are taught also as part of many of these other techniques. And then in terms of the central autonomic network, obviously there's medications that act on the brain or in the periphery that can attenuate some of this output. So for example, beta blockers or blockers that block the parasympathetic drive to the gut and increase gut contractions. So one can block those effects. And if you look at this now in a little bit more specific way, so we can deal with the psychological stress component of the system with the techniques I just went through with you. In terms of at the gut level, various dietary interventions have been proposed. As I mentioned earlier, this has ranged from the time that I was in training from a fiber-rich diet to something where many complex carbohydrates are removed from the diet, so-called low FODMAP diet that is currently in vogue. There's studies that this does decrease symptoms of bloating and IBS, but it's not a diet that is healthy because it starves the gut microbiota. And most patients are not willing to pursue this on a prolonged basis. Then there's probiotics, obviously very popular, promoted on the internet, and with some evidence from research studies, control studies, that some symptoms of IBS, particularly lighter IBS, can be attenuated by probiotics. Prebiotics are essentially similar to fiber, certain types of fiber. And then there is what's probably one of the most common things right now is modulators of secretion, motility, and visceral sensitivity. So many of the drugs that we have today are targeted at this end result of a very complex interactions of the brain-gut microbiome system, that you don't deal with the upstream factors in the brain or the autonomic nervous system. You basically just try to block the abnormal info, the unhealthy influence of this brain output on gut function. And you could say a similar approach is taken today with, has been taken for a long time with medications that treat hypertension. Now, in the future, and this is one exciting aspect of microbiome research in IBS, that one may influence the products or interfere with the feedback mentioned to you that the gut connectome sends to the brain. So there may be analogs in the future of microbial metabolites of breakdown products that the microbes produce, um, or modulators of interactions between the gut microbes and the gut lining. We currently do not have those medications available, these treatments available, um, but it's certainly something many companies are working on. And in terms of modulating brain function, the brain networks, so clearly these mechanisms or these treatment approaches I just mentioned you down here may be beneficial in altering or normalizing brain function. But we're far away from this, and attempts in the last 20 years to develop directly brain-targeted medications, for example, one um, that would block or attenuate the increased stress responsiveness, um, the so-called corticotropin releasing factor receptor antagonist, unfortunately, were not successful. I would not rule out that some of these drugs will come back in different variations, but that approach has really not been very successful. So what we have today, things that really work, are summarized here. Many studies on the effectiveness of hypnosis, um, stress management, and different types of cognitive behavioral therapy. And there's already several studies that have shown that short-term web-based cognitive behavioral therapy may be as effective as the traditional long-term one. And then dietary interventions. This is something right now a lot of people are focusing on, as I mentioned, with a low FODMAP diet. I personally prefer a customized, personalized dietary approach where you start with a gut healthy, um, largely plant-based diet, ask the patients to identify consistent negative reactions to such a diet and identify particular components and either decrease the intake of a particular component of this diet, like a particular type of vegetable, or eliminate it. This gives the patient a sense of empowerment that they are actually the ones that can design the optimal diet for themselves. And it's a personalized approach that, in my experience, many patients prefer and can maintain over a long time period. So in summary, IBS is a disorder of altered brain-gut microbiome interactions. It's not a brain disorder and it's not a gut disorder, but it really is a disorder of how these two systems interact with each other. Dysregulations of the system may be initiated in the brain, and in my opinion, are most likely programmed early on in life in the brain, but also they can start in the gut after an infection, a viral or bacterial infection in different patient populations. Ultimately, it probably doesn't make a difference where the problem was initiated once the brain-gut microbiome system is involved. The treatment strategy will probably be similar. Now, what we've seen over the years, treatments aimed at a single target within this brain-gut microbiome system, such as like a single receptor or a single microbe, have either shown no effectiveness or very small effect sizes, which are often not much better than the placebo response. So this is important to keep in mind, that our current treatments aimed at these single targets are not much better than placebo responses. Now, current treatment strategies aimed at the gut microbiome also have small effect sizes, but have been shown in some studies to be significant, such as probiotics in protein subsets of patients, are often temporary, such as the low FODMAP diet, or antibiotics, which in my opinion should not be given to a patient with IBS because they're harmful for the gut microbiota, and therefore have uncertain long-term effects on the gut microbiome. And so this is the lesson that we have learned in our research and treatment program, that optimal treatment strategies should be aimed at multiple sites within the brain-gut microbiome system, including the brain microbiome-related targets and mechanisms, and diet and lifestyle changes. Um, IBS in the great majority of patients is not that difficult to treat. I would say the majority of patients will respond to a combined multidisciplinary treatment approach. Um, there's clearly patients that have very severe symptoms, often combined with psychiatric symptoms such as depression or severe anxiety. In that case, a, a different treatment strategy may be indicated. And I'll leave you with this, in case you're interested to learn more about this and take more time to go over some of those mechanisms that I explained to you. You can go to our website, emeranmayer.com, which offers you a lot of resources, and sign up for the newsletter. You can also, there's book, the first book out, The Mind-Gut Connection, that explains a lot about mind-gut, brain-gut interactions, including IBS. Or you can pre-order now on Amazon or other suppliers of books, the Gut Immune Connection, which will come out as hardcover June 8th, 2021. And this book deals with how understanding the connection between food and immunity can help us regain our health. I'll leave you with this, and I hope this has been helpful to better understand both how your symptoms develop and also how you various treatment approaches, what the underlying mechanisms are. Thank you.